My presentation this morning was around how the learnings from commerce and industry around transformation of programs and business could apply to the NHS and help them address their QIP agenda. So I talked about the transformation programs that had been undertaken in BT, about how we'd had a long and very successful relationship with the NHS over 60 years, and how over the last couple of years BT's had to go through a significant transformation programme in its own right, and how in most recent years we turned the organisation around, changed the way staff operated within the business, and turned ourselves back into a profitable organisation. And I took some of the learnings and thinkings that we'd taken from BT and tried to apply that in the NHS context, particularly around things like mobile health working. Most of our staff, a lot of our staff in BT are required to work out in the field or in people's homes, and some of the technologies that we use to support them are equally as applicable as working for those people working in the NHS. And I talked about telehealth and telemonitoring and those type of technologies again, which could provide real advantage, stop lots of travel, reduce the carbon footprint, and make a real difference to the way that the NHS was able to treat and manage patients' care. I think if we get the right have the technology that underpins the way that the clinician works, we have the opportunity to get the right type of clinician and the right skills and expertise, the right specialist to the right patients first time. I think we're going to move away from a very traditional face-to-face type contact for many of the patients, and they'll have perhaps remote contacts, the ability to monitor some of their vital signs away from a traditional GP practice or a hospital environment, and for interventions only to be made when those vital signs are outside of some parameters. So traditionally a patient might go to a hospital once a month for a checkup and have those vital signs taken, or go to their GPs once or twice a week. If we can do that remotely, we can reduce the carbon footprint that we're generating by the patients travelling, by the clinicians travelling. We can provide real opportunities to see more patients more effectively. Patients still get the interaction with their health professional, so they still have that interaction and that relationship, and everybody really, from the patient and the clinician, stands to gain a great deal from those type of technologies. There are some significant savings to be made for the NHS in using these type of technologies. Mobile health worker, if an organisation adopts those type of technologies, it means that the travel and subsistence of the healthcare professionals is significantly reduced. They don't have to keep returning backwards and forwards to the health centres or to the practices in order to collect armfuls of records. And some of the case studies we've been looking at have demonstrated some really significant savings for both individual clinicians and for the organisations, just by taking out the cost of travel and reducing the cost of travel. And if you add that to the transformation, and the way that it makes everybody more work efficiently, so you can actually increase the throughput as well. There's a really solid business case to be made for employing those types of technologies.